All right. Well, good afternoon, everybody. My name is Stacy Gavrell, and welcome to our 2022 Town Hall. So thrilled to be able to connect with everyone here today and talk about Valley View's work, but also really striving to have some questions, some feedback, as we know as your community hospital, that we stand better and stronger when we work together. So I want to pause just for some quick introductory kind of housekeeping. We are thrilled to have Spanish interpretation simultaneously. So we're going to pause and get those instructions in the chat. Looks like we may be having some technical difficulties with that. So Leslie, I'm going to see if you can troubleshoot the interpreter feature, please. There we go. So for those joining us now in the chat, you can see how to access the real-time interpretation. So again, in real time, as we go through this presentation, we have some incredible partners with us on the Zoom who will be providing interpretation in Spanish. So appreciate that collaboration. So we just want to kick off and kind of set the stage a little bit. So first and foremost, we want to present and get your feedback on our new community health needs assessment. So this was an assessment we conducted in 2021, so just a few months ago, but really going to dive into that assessment and our plan. And so grateful that a number of the stakeholders who collaborated with us on that assessment are joining us today. This was a process that surveyed the community, but then also included key agencies and partners to inform the identification of key priority health needs for Valley View's focus, and then further informed an implementation plan, which we'll also be talking through. We're also going to be sharing the Colorado Hospital Transformation Program. So this town hall is also serving as Valley View's public input meeting related to what we call HTP. If you know healthcare, you know we have an abundance of acronyms, but that is the Hospital Transformation Program. So we want to showcase our recent efforts on pertinent topics, and we also want your feedback on these efforts to make sure that we are reaching who we need to serve and best serving them as well. So I think the overall context is we have some incredible panelists joining our town hall, but really invite you and actually ask you to please ask questions, chime in. For those of you representing different organizations and agencies, would love to hear where you all are in addressing these needs and opportunities for additional collaboration. And then last but not least, we are recording this event. So not only to hopefully create kind of a standing resource for us to continue to review, but also to make it public so others who perhaps were not able to join us can benefit from the meeting. So with that, I'm going to introduce my colleague, Rob Nelson, who is the Executive Director of Quality and Safety at Valley View. And Rob is also a PA with Internal Medicine at Valley View. So I'll turn it over to you, Rob.
Thank you, Stacy. And I don't know if Stacy got to really introduce herself as she got us kicked off. So Stacy is our Chief Community Relations Officer. And how long have you been at Valley View, Stacy?
I've been here since 2009. So
very good.
And still every day grateful to come to work.
Yep, and we're happy to have you. So thanks for getting us started. Well, I'm really excited to be here. And before we get into some of our content and really quickly out of the gate, welcome input, I do want to just introduce our other panel members. And so we have Dr. David Brooks, who's our Chief Medical Officer and also a pediatrician here at our Pediatric Partners practice. David, if you want to just make sure that we're hearing you there and say anything else for welcome.
Sure. Again, as Rob said, I'm David Brooks. I'm the Chief Medical Officer, which kind of means I have an administrative position that helps oversee the quality and the safety of care here at Valley View. And I also still work as a pediatrician in our community. I've been here for 21 years, practicing at Pediatric Partners. So I'm glad to participate in this town hall, and I look forward to hearing your comments.
Thank you, David. Chris Hubble is our Quality and Data Advisor. Welcome, Chris. We have Chris, I don't know if I'm hearing you on audio there, so we'll come back to you here in just a second. We have Amy Johnson, who's our Regulatory and Safety Coordinator here at Valley View. Welcome, Amy.
Thank you.
Michelle Krelovich is perhaps on. I know she was wrapping up with some patient care this morning, so we may need to give her another moment for joining us, but we will come back to Michelle. And finally, Jen McPherson is our Emergency Department Facilitator and has many acronyms after her name. And I think every one of them is well-deserved, but I don't know what they all stand for. Jen, will you be humble enough to walk us through your credentials?
Sure, I'll make something out. I'm not really sure what they stand for either, but we'll work through this. Hi, my name is Jen McPherson. I've been with Valley View for 25 years. I am a registered nurse. I have my master's degree in nursing, which is the second one. The third one is a certified emergency nurse. And I am a professional development certified registered nurse, which is the second to last one. And the last one is I'm the stroke coordinator for the hospital. So I am certified in stroke as a stroke coordinator RN. So
Thank you. That's fantastic. And as I mentioned, all of them well-earned and much appreciated for your input there. Let me go back to Chris and just check to see if her audio is functioning well.
Hi, can you guys hear me now? Apologies.
That's perfect. No problem whatsoever, Chris. Thank you very much. And again, we'll be watching for Michelle to join us a little later in the presentation here. So what I want to do first is just something that we frequently do in many of our meetings here at Valley View is start with safety. It's one of our core values, and we know that if we don't start with safety, we're not starting in the right place. So on that note, I want to turn it over for a moment to Dr. Brooks and start with safety.
Yeah. So Rob, thanks for that introduction. I think safety and exemplary care is what we strive to do here at Valley View. Caring for you and your family one patient at a time is at the heart of what we do. And to keep it at what we do, we have to make sure the patient is at the center of all our actions each and every day. And of course, healthcare is complicated. We all get bogged down with the daily work and the grind, but we always have to be reminded of why we're here. And to Dr. Murphy's credit, Dr. Murphy's our CEO, he has made safety and patient-centered care the top priority of everything we do. And so at every meeting, we start with a safety story. And safety is talking about things we care about. And we talk about a safety story or exemplary care just to keep it top of mind. And so we do this at the administrative level and at every level. So I do want to open it up to the community members and see if they have any exemplary care or safety stories they would like to share. And we'd love to hear some of those. And so I'll pause briefly. If not, I'm going to quickly tell a quick safety story. So is there anybody that has a great safety story or exemplary care they'd like to share about the care that has occurred at Valley View? And you'll have another opportunity. So I'll start with one of my favorite for the year. So, healthcare is complex. And one of our orthopedic surgeons was called into the ER late at night to operate on a knee that was infected, or at least they thought it was infected. The orthopedic surgeon came in, was told that they were going to have to take this patient to the OR to wash out their knee for an infection. And an infection of the knee can be a very, very serious event. But fortunately, that orthopedic surgeon kind of had his internal smoke detector on. We call it validate and verify. He was kind of wanting to make sure everything was right. And when he assessed the patient, something just didn't seem right. Infection seemed like a possibility, but there was something more potentially going on. And so in these situations, of course, the easy thing would be just keep going, just take them to the OR and clean it out. But our orthopedic surgeon stopped and paused and started to ask some probing questions. And in fact, went up to the lab and said, let's take another look at this slide to see if infection is really present. And after working through the slide with the laboratory technician, they determined that maybe this wasn't infection, but rather what we call gout or crystals in the fluid. And it was that pause, that validate and verify, that really focused on doing what's right for the patient. It turned out it was gout. It was not an infection. And we were able to avoid an unnecessary procedure for this patient and actually keep them safe. And so it's that type of thinking within our organization that really is the core of what we do. And so shout out to that orthopedic surgeon who basically saved that patient a trip to the OR. So anybody else with a quick safety story from our participants or an exemplary care? Want to open it up for a moment. If not, Rob, why don't we proceed? And so thanks for letting me share that.
Thank you, David. I know it's a great story because as we often talk about, once the train is moving forward, it's hard to slow the momentum. And that's true for clinical care also. You get a culture result that comes back. It's hard to push back and have that questioning attitude when you're looking at a result like that. So thanks for sharing that.
Right. You got to keep safety number one. In fact, I don't know if people quite understand how healthcare works, but that surgeon gets paid to do surgery. When he doesn't, it's worse for him, but he's got the patient at the center of what he's doing and will always do the right thing. And that's the key.
Very good. Well, Stacy, do you want to tell us a little bit more about the CHNA process and where we're at with that process today? Because that's going to be guiding a lot of our discussion and interactive dialogue with our community members.
Yeah, absolutely. I mean, I think, Rob, you and I had the opportunity to work closely on this, and looks like a number of our attendees did, as part of really a collaborative approach to assess the health needs of our community. So, since 1955, Valley View has been here serving our community, providing healthcare services. We've obviously changed and grown a lot, but something that we do every 3 years is to pause and really identify what are the health priorities of our community, and how in that assessment can we further direct our own benefit programs and services. And so through a process that kind of had broad community input through a survey, but then also this dynamic working stakeholder group, and then an outside consulting agency also joined us to facilitate it. We identified 2 healthcare needs in our community that we as Valley View prioritize to focus on for the next 3 years. And you can see here on this slide, that's coverage and total cost of care and behavioral and mental health. And so for us as an organization, we've committed not only in the identification of these needs, but also in a resulting implementation plan. So we've said behavioral and mental health is a priority here at Valley View. What are the kinds of impacts we want to create in that space? What are the actions we're going to take? Who are we going to collaborate with? What kinds of resources are we as an organization going to apply to addressing these needs? And so, as Rob alluded to, the assessment is really going to further frame the town hall today. But it's also going to reflect what is the hospital transformation program. So I'm going to kick that back over to Rob, and he's going to talk about HTP.
Very good,
Back to
Stacy.
you, Rob.
Thank you. So, community health needs assessment, 2 topics. Sounds simple, straightforward. Those 2 topics are neither simple or easy to address, and I look forward to sharing the details of just how Valley View is going about that. To talk a moment about the hospital transformation program, relatively new program from the state of Colorado. It's a 5-year program by definition. It is a penalty only program, so we have a lot at risk if not participating successfully with this program, but we do see the forest through the trees with that. And we recognize that the program is intended to benefit patients, and specifically Health First Colorado patients or Medicaid members. And frequently, addressing health needs for those members is of utmost importance, especially as we want to provide safety net for the community and ensure the best outcomes for all of our community members. So this 5-year program, I have just briefly mapped out on this slide to kind of demonstrate what we will be working through over the years to come, with frequent reporting to the state of Colorado on at least a quarterly basis for both the more subjective work that we're doing, what type of meetings and improvements that we're making, as well as metrics that we report and the performance on the measures. So Valley View has chosen a total of 10 measures. 6 of those are statewide measures that were sort of set for us. 3 were what we call local measures. And then we did choose one statewide priority also, which was the dual track urgent care. So rather than to go into each of those 10 measures in detail at the moment, we're going to kind of provide a crosswalk to the work we're doing on those measures throughout our slides today. And again, the purpose of this presentation isn't just to provide information to the community. That's just the first step. The more important factor is getting feedback and hearing if the community thinks that we are on course or if we need a course correction as we prioritize together. So our coverage and total cost of care, kind of that first priority that Stacy highlighted as our implementation plan for the community health needs assessment response. And what I'd like to do is just go into that in a little bit more detail. So Dr. Brooks and I have some more finite pieces to share, and let's go through that, Dr. Brooks.
All right. So I'll start off just with talking about improving our coverage and our total cost of care. And we're all aware of what's happening economically. There are inflation is off the charts. We've all been to the gas station. There's a shortage of workers. And here at Valley View, we are seeing some of those pressures impact us. Traveler nurses, which you have to get nurses to come in to fill unmet needs, are very expensive. Inflation has impacted our ability to buy supplies at the cost that they were previously, but we're committed to keeping that total cost of care down. And by doing that, we improve our coverage. And so we've embarked on a process to improve operational efficiencies so that those inflation and those other issues don't affect our community. And I think to sum it up best, I think Muhammad Ali actually said it best. He said, often it isn't the mountains ahead of you that wear you out, it's the little pebble in your shoe. And so the mountains ahead of us are the inflation and the cost pressures to raise costs to our community. What we are focused on is the little pebbles that'll make us better without passing those costs on to our community. And so we've embarked on a process where we have one individual, Josh Anderson, who is going from department to department to improve efficiencies, as we find what we say is remove the pebbles from our shoe. And so we're going from department to department, looking for ways to improve care at the small little things. If we can save a minute here, a minute there, and we can do that 5, 10, 15, 20 times a day, we can save a half an hour per provider, allowing better access. And so we've gone across the organization, and it's simple things like helping patients complete their questionnaires in a timely fashion so that we're not redoing it. It's simple things like getting patients room faster so that we're not wasting time, removing that duplication of work that often happens in healthcare. And so that's one of the things that we've worked on, is removing the pebbles from our shoes.
Agreed, Dr. Brooks. Staying budget neutral is important for the hospital to remain a community partner as an independent community hospital. I want to highlight Valley View's really generous financial aid offerings. So amongst hospitals in the state of Colorado, Valley View has one of the most, if not the most generous financial aid package available, which goes up to 500% of the federal poverty level. So in 2022, for a family of 4, that would be an income of $138,000 a year. And so that family of 4 would receive at least some significant reduction in cost of care, regardless of necessarily whether that family was insured, uninsured. This financial aid package can help all patients meeting those financial eligibilities. So not insignificant of the finances that are poured back to the community in that way. I want to talk about another piece, which is competition. Dr. Brooks, will you maybe walk us through some of that recently here at Valley View?
Yeah, we're excited to announce that we have contracted with another health plan that's going to be coming to our community this fall, called Friday Health Plans. And so we've added Friday Health Plans to our portfolio, basically to add greater access for insurance to our community. They participate in the individual and the small group space, which matches with what much of Garfield County needs. But I think what is critical here is Friday Health Plans contracted with us. We're excited that they loved our rates. And we also know that Friday Health Plans is trying to grow their market share. And so they like contracting with us. We like the idea that they have to grow their market share. And the only way they can do that is by offering a discount to our community. And so we're very, very hopeful that this competition will lower the costs on the individual and small group market, because they have to grow their market. And I think they've grown 400% in recent times in the state of Colorado. And to do that here in Garfield County, the only way they can do it is to offer you, our community members, a lower rate than what the other insurance companies are currently offering. We know that that competition will also hopefully drive down their prices as well. And so we're excited that we've contracted with Friday Health Plans, and they'll be coming hopefully to us this fall.
Certainly, that's not the only thing as far as partnerships with Valley View. You know, I'd be amiss if I didn't talk about our work with Valley Health Alliance and the innovation that we're really after in delivering high quality care, comprehensive care. And Valley Health Alliance, that's central to their mission: the right care, the right time, the right place, the right price. And so Valley View, as a member of the VHA, and with our employees as members of the VHA, we're ensuring access to primary care, finding alignment that employees or individuals are assigned a primary care provider is so important, because keeping up on preventive care, screenings for things that matter for health outcomes the most, really we have to have that access channel and those priorities aligned. Valley Health Alliance does some really unique things around how they look at quality, especially in the small employer space, and the quality measures that are being used at the individual practice level through VHA alignment. It has really been neat to watch and to be a part of. Care management is another big element to VHA's work, both recruiting and training care managers within practices. And beyond that, if a practice is too small to sustain their own care manager position, then VHA actually has the ability to work with a partner and provide offsite care management that is still integrated in the practice in that workflow. So I believe we may even have one of the VHA folks with us, with Chris McDowell as one of our attendees. So thanks for joining us, Chris. Is there anything else you would like to add? I know VHA is a thing that you could talk about at length, and I'd be open to sharing any additional details with our other attendees, Chris.
Yes, thanks, Rob. Sure appreciate the shout out to the efforts of our work in partnering with Valley View, and all of this has been critical to our success. And, you know, making healthcare affordable, accessible, and the highest quality is really what it's about. And I guess as we move towards price becoming more of a quality measure, I think we're going to see improvements all the way around. And I'm very pleased, excited to be part of what Valley View is doing to integrate with the HTP program, the Hospital Transformation Program, and for its work in connecting with its community and meeting the needs of its community in a very meaningful way. So very glad to be part of this, and very glad that the VHA has partnered with Valley View in helping solve the riddle of healthcare. So thank you.
Well said, Chris. Thanks for being with us. And yeah, we'll keep on the journey together. Let's go ahead and go on to our next kind of category, which is enhanced primary care and management of that total cost of care, which we were getting at through that discussion around the VHA and some of those elements. Dr. Brooks, maybe you could highlight some of the pieces for primary care that we are looking at around cost and access.
Sure. You know, I hope many of you have heard this before, and maybe I'm a little biased because I'm a pediatrician, but primary care is the backbone to high quality, affordable care for not only our community, but our nation. And if you look at other countries, they get this. They have a lot more access to primary care than what we do in the United States. But at Valley View, we are definitely committed to supporting primary care. Your primary care provider helps you stay out of the ER. I think it's probably 20 to 50% of ER visits are unnecessary. Your primary care provider keeps you out of the hospital. Your primary care provider helps do all that preventative care that keeps you well, rather than the reactive care that you get when you're beyond that stage. Your primary care helps coordinate your care amongst your specialists. So getting you in with a primary care is a cornerstone of what we want to do here at Valley View. So if you don't know, we have 5 primary care practices. We have Roaring Fork Family Practice, Silk Family Practice, Eagle Valley Family Practice, Internal Medicine, and of course, my favorite, Pediatric Partners at Valley View. And so all those are our primary care providers, and we continue to support the primary care providers so that they can provide the care that they need. And so if you don't know, all our primary care providers accept all patients, regardless of their insurance or if they're uninsured. And we have many options that Rob mentioned earlier about financial aid for those. So we want to get people in with our primary care providers. And at each of those settings, we're trying to enhance that by allowing care coordination, other parts of the care. So it's a team-based approach so that we can enhance the care for you and your family. And so we're always focused. So even if you go to the ER, one of the objectives we have is asking whether you have a primary care provider, or if you go to the urgent care, and then we coordinate the follow-up with one of our PCPs so that you no longer need to go to the ER or the urgent care. And so we're always trying to get people established with what we call a medical home.
Perfect. Thank you, Dr. Brooks. Such an important part of really the whole care delivery mechanism in the US and how we have our work cut out for us for those health outcomes. I want to touch just for a moment on additional support we offer to community partners. One of those important partners is Mountain Family Health Centers. We do see, the partnership as imperative for the long-term success of the health of our community. Valley View supports Mountain Family through paying rent for space in their Glenwood clinic. Certainly they have multiple locations, but that Glenwood clinic, we do support the rent there for the tune of $400,000 in cash a year. So a significant investment that Valley View makes with Mountain Family as a partner. Not to mention the day-to-day clinical operations. We work closely with facilitating coordination for those Mountain Family patients. If they have an emergency come up and they have to visit the emergency room, getting that full circle of care back to that patient through primary care, accepting referrals to our specialty practices that we'll get to further in just a few minutes here, but really want to offer support for these important partners. I'd also highlight, provider recruitment is an important piece within a rural community. It's not always easy to find new providers, even though we all value individually living in or near the Roaring Fork Valley and how beautiful it is here. It's still a rural community, and sometimes getting providers here is hard, especially when providers train in urban academic centers and aren't always inclined to come to somewhere like the Roaring Fork Valley. So Valley View does support financially other entities. In the past 18 months, we've helped Glenwood Medical Associates recruit 2 new family medicine providers. We're currently supporting at least 1 other primary practice not associated directly with Valley View with recruitment as well. We see value in that for the health of the individuals, our own friends and family who live here in our mountain community. I do believe we have Ross Brooks on from Mountain Family as well, had been one of our attendees. Ross, anything further you'd like to add? We just value the partnership with Mountain Family so much.
Yeah, thanks, Rob. This is Ross. Can you hear me okay?
We sure can. Yeah, thanks.
Hi, everyone. Ross Brooks, CEO and patient at Mountain Family Health Center. Certainly grateful to Valley View for the support of Mountain Family and the care we provide to folks in the community. And I really want to just echo the goals that you've come up with around coverage, total cost of care, and behavioral health, mental health access are key goals for our collective community. So kudos on that work. I think the challenge for us that I would just say transparently, since this is a town hall, is our uninsured rates in our community in Garfield County, Pitkin County, and Eagle County are still exorbitantly high. So this is good movement in the right direction. And we have to recognize that, at least at Mountain Family, 40% of our patients remain uninsured today, August 2022, after lots of good work at the community level, state level, and federal level. So any ways that we can continue to try to get as many folks covered as possible to bring down total cost of care so people can access important primary care like Dr. Brooks talked about, behavioral health, mental health services, to take cost off the table so folks can get the care they need. We're certainly your partners in making that happen. Last thing I'll just say really quick is kudos to doing this meeting in Spanish and English today, because we want to focus on equity and make sure that all of our populations, including the growing Spanish-speaking population in our communities, can afford and access the care that their families need. Thanks.
Thank you, Ross. Great points. Well taken, and I think it's so nice to have the alignment and working in parallel for these goals. So thank you for being with us. I want to have David, Dr. Brooks, talk for just a moment about some of the innovations around comprehensive care that we've been offering as of late.
Right, and appreciate Ross Brooks, no relation, but a great partner. And so that's how close we are. We sometimes share the last names, that we're such a great partner with Mountain Family. So in order to enhance that interaction between not only Valley View, but our care partners, be it at Grand River, Mountain Family, GMA, Mid-Valley Family Practice, we have to support the integration of information flow from one resource to another. And so to that end, we have multiple commitments that are ongoing to support the flow of information across the care facilities in our community. One of our most recent implementations is a secure messaging platform. We're all familiar with text messaging. We use it every day. Well, you can't really do that in healthcare because it's not HIPAA protected information. And so we've recently purchased a product called Telemedic that allows us to share care information through a platform that's Telemedic, that's text messaging, allows images to be shared. But I think one of the most important parts of how this impacts our community is we're sharing it with our providers at GMA, at Mountain Family, eventually at Grand River, so that that care transition from the outpatient family practice to the inpatient to the ER, or vice versa, from the inpatient to the ER out, can be coordinated and timely so that the patient gets the care they need. And so this system integrates all our care providers throughout our community. Other things we've worked on is QHN, that's our Quality Health Network. We all know that there are various electronic health records out there in the community, and QHN has been a partner in absorbing or taking all those EHRs and putting them in one resource so that a care provider such as myself or somebody at Mountain Family can see what happened at the specialist or what happened in the ER. And that is a resource that we support for our care provider partners. And then lastly, there's something called Community Resource Network. Ross kind of touched on this a bit, but our social determinants of health, these are the other things that impact our health, like socioeconomic status, our ability to get the housing we need, the ability to get the food we need, the ability to understand the healthcare. This community resource network that we support for our community helps coordinate those resources for our care providers so they can enhance the care that they provide their patients.
So cool to have that our brains really know what that is. I mean, you can't tell us, oh, this is really this is a spring day.
It is an important service. It's still relatively new here at Valley View. We're working to optimize our use of the CRN tool, but very excited about it. I think one point I just wanted to highlight of those that Dr. Brooks volunteered was that Valley View helps cover the cost of some of these important tools to the tune of several $100,000 a year. These things aren't, they're very complex tools, they're important tools, and we see the value in them. A piece that I want to touch on here is our, in a similar light, is sharing electronic records. You know, for a long time, I feel like there had been a bit of the dark ages where many of us are on electronic health records, but you see one practice, you see another practice, and never the two shall meet in your record file system. That's getting better. It's getting a lot better. I'd be amiss if I didn't admit that Valley View still has some disparate electronic health records. Nevertheless, tools like Quality Health Network help tie those together. One of the measurable targets, including under the Hospital Transformation Program, is how we share that electronic summary of care. And so I want to go over to Chris Hubble, our data and quality expert, for just a moment here. And maybe Chris can weigh in on how we're looking around this measure.
Thanks, Rob. Can you guys hear me okay?
Yeah, very, very well. Thanks, Chris.
Great. So we're actually, it's hard to know how we're doing because we're just starting to get to benchmarking ourselves against some other standards. But the opportunity that this is presented to us is prior. Medicare has kind of made initiatives that we have to be able to have this in place to be able to share electronic records. But now with the Hospital Transformation Program, they're actually now gauging how well we're doing this. So the opportunity that we are presented now is to dig into our data to find out where those connections aren't happening, so we can improve the processes and make sure that the connections are happening for all patients and not just certain patients.
Very good. Thanks, Chris. And another piece that maybe I'll ask Dr. Brooks to highlight for us is some of our translation services.
Yeah, I think Ross Brooks highlighted this. I think this is a tremendously important topic, and it's basically about health inequalities or health disparities. And these are situations where there are inequalities in our healthcare outcomes that are not related to underlying medical illness. They can be related to access of care. It can be related to disadvantaged populations having access to health insurance. But one of the things that we really thought was critical is all individuals need to have the ability to communicate with their care team and their care provider. And so we had a translation service that previously existed at Valley View, but it was not good enough. We were struggling getting it to come on. When translation services aren't easily available, people tend to have workarounds. They try to use part language, and we knew that was unacceptable. And so we terminated the previous contract, explored all the options, and found a new service that is very efficient, very high quality. And by simply making that available throughout our organization, we have seen a significant rise, which you can see here in the graph, of the frequency of interpretation use per minute, per month, per minute, or the number of minutes per month that we've used. And what you can see is just in the last year, we have had doubling the amount of translation services. And this is a quality of care service for those individuals that don't speak English. And so we're proud that this is expanding, and we want to continue to expand it.
Very good. I think we've seen an increase of about 70% as far as the measured time minutes between December of 21 and May of 22. Significant rise in the frequency of use, which says a lot for the diversity of care that we're able to offer around that.
And it's not just Spanish.
Right.
I've done it with Chinese. I've done it with family from Madagascar. So it's incredible.
So Dr. Brooks, if you would be willing to maybe tell us as well some about the telehealth services, because I think you're maybe in a little bit of a unique role where you see the telehealth needs both in and out of the hospital, and the inpatient and the outpatient side of things.
Right. So we are committed to providing telehealth. Certainly the pandemic probably opened the box of telehealth, and we wanted to embrace that when it started. And so we are currently offering telehealth services to our patients in our community, to our local providers here. So that's when the patient's at home and we provide telehealth services. And I know for our PCPs and some of our specialists, this allows for access to care when maybe there's a barrier after hours, or maybe there's a barrier of travel. And so many times myself is I've offered telehealth services rather than have the patient go to the ER or to urgent care. And so we offer that throughout our organization for all our PCPs, and we've seen a tremendous increase in the frequency of telehealth. It did spike in 2020 when we had the pandemic. It's gone down a little bit, but I think that's just the normalization, because I think there was too much telehealth back then. And what we're finding is that normalization of the amount of telehealth. The other part of telehealth that we're offering is when you're in the hospital, sometimes people have unique needs where we have to have a specialist, and that specialist is only available in a large city like Denver. And so we have access to telehealth for infectious disease, for neurology, for stroke, for soon to be for neonatal intensive care, for behavioral health, for endocrinology, hopefully soon for nephrology. And so these are all specialties that we don't have the volume to have that specialist here in Glenwood. But now that we can access them through high-tech telehealth, our patients get those services right at the bedside in our hospital.
Oh, very good. I would also just weigh in that at least a couple of our primary care clinics offer online scheduling. So it's entirely possible to be on your smartphone, schedule your appointment. Maybe that's in person, maybe that's by telehealth. Complete the appointment right there on your smartphone, and really find that seamless and efficient. We realize that patients desire these services and the efficiency that that affords. So we are working to meet those expectations.
Do we have a question from Judy?
Yeah, Judy, it looks like you have your hand up. Anything to add in there, or questions, comments?
I was wondering about your some of the programs that deal with your uninsured population, and you said also insured population in helping people with the healthcare costs. How would that interface with people who are somewhat underinsured, who have a health insurance program with an extremely high deductible and some other things? How would that work?
Judy, great question. I appreciate you bringing that up, because yeah, I realize both here locally as well as national trends that sometimes folks do have very high deductibles on top of what they're already paying for their healthcare premiums. It's well realized, and Valley View, through that financial assistance program, again, even if a patient has insurance, they can qualify for assistance through that financial assistance program. If they're eligible based on annual income, which is again a pretty high bar for a lot of people can be eligible for that. So we certainly help in that way. I will also mention that more towards the uninsured than the underinsured side of things, Valley View has really seen exponential growth and how many patients we've been helping sign up for insurance. We have more staff that are spending their full-time hours working directly with patients who we find are eligible for programs, whether that's Health First Colorado, Colorado Medicaid program, CICP, CHIP, some of these various programs that folks just haven't known maybe that they historically had access to. And then, as Dr. Brooks mentioned earlier, partnering with new insurance providers to really get at the true cost of care here locally for our community. Judy, does that help as far as getting at your question?
Yes, and a little more specifically, if a patient comes in, how will they know to ask that question of how do they get involved in these programs, especially at your primary care clinics and other clinics that you're involved with?
Yeah, so we do have some proactive patient-facing materials. We have cardstocks around the patient financial assistance program, and we also, in alignment with some new Colorado legislation, have to ask for the status and financial viability for those patients to receive services. And we think that's where we're seeing kind of that exponential growth in the enrollment, is because we're doing more reach out directly on the individual patient level than we've ever done before, and it's paying off. We're getting folks insured.
And another question about that: if you have a family that has mixed immigration status, or how are you able to work with a family that has some financial challenges and the immigration status challenges? Would they be would they be able to access that assistance?
Absolutely, yeah. We don't discriminate based on that, and certainly reach out Many of our front desk representatives at the various clinics and services are bilingual at least. And again, as Dr. Brooks mentioned, our translator services previously for a really multitude of languages that we have access to. But we do work to get those patients aligned for care that they can access in a realistic manner. Dr. Brooks, anything further that you would want to weigh in around that question that we got?
No, I think you covered it well. Our goal is to support those individuals in their financial needs.
Mhm.
Oops, super. The other question is a little bit off that subject. I don't want to monopolize your time, but
No, please, that's why we're here, Judy. No.
as you mentioned, the cost of living has skyrocketed. I understand that Carbondale, for instance, housing cost of housing has gone up 135% in the last 12 months or so, which is just astonishing number. And I know that it affects not only the people, the teachers and other people that don't want to move here, but also potential nursing recruits, physical therapists, and even physicians. And I'm wondering, how are you assisting people in looking at housing, and are you involved with the larger community in developing some housing opportunities for these extremely necessary professionals and that want to come to our community but really can't afford to?
Sure, Judy, I love your question because it's really front of mind for all of us, and it certainly is here at Valley View. One element that you mentioned was the struggle that healthcare providers face in offering care, because we have to have staff to do that. It's a very service-oriented realm, and we've struggled over the last couple of years through the pandemic with that and with housing. We've seen the use of our travel nursing staff, not just nurses, but other positions as well, double and triple over the course of the pandemic. That has huge financial implications for Valley View, as it does for other healthcare providers, both in our community and beyond. It's hard to accommodate those challenges. Housing is so important that we continue to talk about housing and access there. Valley View, as an acute care hospital facility, our mission is to partner with the community, caring for you and your patient, you and your family, one patient at a time. We do that through our healthcare services, but we're not in the housing business. Sometimes we wish we were, because we know that's such a need, but if we expand our breadth too much, we're not going to be good at what we need to be good at. So we don't dive into the housing realm too deeply. But I can tell you that we are excited for additional multifamily dwellings coming online here in the coming year, with several apartment complexes opening, because we don't have places for our staff. And if we don't have places for our staff, we certainly know that other community members are challenged by the same thing as a huge social determinant. We know social determinants probably comprise 80% of our health outcomes. So although it's important for taking your blood pressure medication and that we get that right, that's still 20% of that health outcome pie compared to things like housing, food insecurities, transportation. It's why we're partnering with West Mountain Regional Health Alliance to help be part of that discussion, get at those bigger pieces for social determinants of health. And I look forward to sharing in just a couple of slides how we're doing that internally as we meet with patients one-on-one. So great.
Hey, Rob, can I just jump in a little bit?
Please do, Stacy.
Judy, really appreciate you affirming what is clearly a huge conversation in our community about housing. And one of the roles I have is actually, to sit at the many meetings and conversations talking about housing. And so, I think we at Valley View are trying to, just as Rob has kind of illustrated, inform the many conversations that are happening, whether it's, the city of Glenwood regarding, homeless population, to housing or workforce, to the regional conversations. And so in as much as we not only appreciate housing, as Rob stated, in the connection to overall health and well-being, but that connection to the fact that we are one of the area's leading employers. And so we're absolutely at those conversations, and certainly, developers reaching out to us, trying to frame their plans, always willing, and certainly do talk to those individuals looking at Glenwood Springs and how they can potentially help with our housing issues. So just want to affirm that we're absolutely part of those community conversations. Thanks, Rob.
Great. I do. I think being part of it is really absolutely necessary, and there are quite a few new conversations going around. But also, you're one of the largest employers, and like the school districts and others, there is enormous clout in what you have to say. And also, I should say, the ski community, just all kinds of our amenities. So your being able to inform them is really important. But I'm wondering if you would also be willing to look at committing some actual cash into being able to support some community initiatives that would provide maybe housing, not just at market rate, but some other kind of sustainable and perhaps affordable rather than just attainable housing, or just getting involved in a conversation, since I think you're right. So much of our outcome is the social fabric, the social issues for patients' health. I mean, stress is just enormous already. But anyway, getting back to that, I think I'm glad that you're communicating with all these groups. It's also, I was wondering if you would ever consider that internally, of saying, how can we actually contribute besides just in our conversation and our metrics?
Yeah, I mean, I think, Judy, if you want to, direct message me if I'm, if there's an opportunity to further connect Valley View with the conversations and groups that you're referencing, I would absolutely welcome that. So drop me a note, please.
Sure. Thank you, Stacy. I appreciate it.
Thanks, Judy.
Very good. To kind of continue with the inclusive care focus that Valley View's had, just to highlight some recent offerings. We had a recent medical provider continuing medical education offering around caring for gender diverse youth that was back in April with all of the community medical staff invited. Fantastic presentation from a provider at Children's Hospital. And then we did touch on how we're working to enroll as many diverse members of our community with either health insurance or financial assistance that's within our reach. So I'd like to move on to another element of our presentation today, which is around understanding the patient well-being and effective strategies for wellness, and then access and quality care for coverage and cost management. So to that piece, I'd like to again highlight the Community Resource Network. On the left, you see the diagram for some of our internal workflows as we pivot to screening just a subset of our population that comes into the hospital to really screening everyone for those social determinants of health. And fortunate to have the platform that we do. I will mention that is also one of the crosswalk measures for the hospital transformation program with social needs screening. And if patients have social needs that are identified, referral to our local Medicaid RAE or regional accountability entity, who then can surround that patient with additional resources in tandem with community partners. Dr. Brooks, would you be willing to talk for just a moment about some of the momentum we have for our specialty services and ensuring that we continue to offer the breadth that we do here?
Sure. I started the conversation, I talked about the importance of primary care, and now I'm going to move to the importance of specialty services. And I'm always shocked when I speak to some of my colleagues around the state. I tell them that, we're really a small rural hospital that has about 80 beds, and they create an image of who we are. But then I tell them that we have a cancer center, a radiation therapy, we have an open heart program, we have a cath lab, we have a neurosurgeon, we have infectious disease. We have all these specialists that allow for us to provide world-class care here at home. And it is critical that we are able to do that. I think the other option that does occur in other communities is when bigger organizations take over a small hospital like ours, they don't enhance the specialty care, they pull it away. And what that means is you'll be driving over a mountain pass to Denver in the middle of the winter to get these specialty cares. And so we are very committed to a diverse number of specialties. In fact, our GI doctor that we brought in, Dr. Magdi, has such specialty services that we're getting referrals from St. Mary's now. And so we have not seen that in the past. And so they're sending patients to us. So I think it's an incredible benefit to our community. But to make that happen, we have to be creative, and we have to make sure these specialists are economically feasible. And so what we've done is we've partnered with places like Aspen, Grand River, Meeker, Craig, and we're sharing the cost of these specialists, but we're bringing these specialists to those communities as well. And so our outreach has basically enhanced our ability to provide specialty care here in Glenwood Springs.
Very good, Dr. Brooks, thank you. I also just want to mention that our specialists do accept all categories of insurance as well. That was an HTP measure within that, remember, that hospital transformation program. That was one of the available measures to select. We did not select that one because we already went above and beyond selecting on number of measures, but one that we feel we're really already accomplishing because our specialty providers do not close their doors to any insurance carrier that patients have. We are accepting all patients. I would also then just highlight again for our specialty care focus that multiple languages are facilitated, that was mentioned earlier. So to talk briefly about additional elements that better managed for cost through appropriate care channels. One big one is the after hours urgent care that Valley View has had for a couple of years now. We've seen that it helps a lot of people from out of town, but also local residents that maybe it's just outside of our primary care providers' hours, but they really don't want to have to go to the emergency room. That's the intent of this after hours urgent care. And we've seen volumes consistently grow over the last year and a half that this service has been available. We partner with our primary care providers to ensure those patients who come to urgent care and are pushed back to the primary care management realm because we know that's where the best care happens. We also help to refer folks to a local primary care provider if they don't already have one, which is so imperative for reducing utilization in the emergency room, reducing cost, and ultimately reducing hospitalization and poor health outcomes. So I think it's a really valuable service that the hospital offers, and again, is one of the state identified priorities through the hospital transformation program for a dual track emergency department. Let me pause on that and to talk about a couple of related items that I'm going to pivot to Chris again for some of the metrics we may be able to access early in the HTP program. One is our called the measure for hospital index. Chris, will you just frame for a moment the hospital index measure?
Sure. So the basis of the hospital index measure is it's about looking at your total episode of care, not just looking at how much care cost while you're within the four walls of the hospital. We're looking at like the 30 days prior to an event in a hospitalization to the 90 days post hospitalization. And looking at that total episode to see if there was any care that was avoidable or duplicative that we could have been more efficient with, saved the patient money, the hospital patient money, and then actually produce a better outcome for the patient.
Perfect. And do we have an early scoring on that? Have we gotten any of those numbers back?
We have some early scoring, though it's kind of historical in nature. It's not real-time data. But we do have some data that shows that we are performing in the mid-range to a little bit better range to those other HTP hospitals in our cohort.
Great to hear. I know we'll have our work cut out for us over the next 5 years as we really dial in on that measure, but it's nice to hear that from the start here. And then how about one other one, Chris, that's also a very important HTP metric, which is severity adjusted length of stay.
So length of stay, we don't have any. We have, again, historical data from our hospital transformation program group. Again, we're doing well. We're under what they consider the norm. So our length of stay means that we're getting people home quicker, which is, we also know people are healthier at home. So we're doing well on that measure. We still have a lot of opportunities to kind of dig and see where we can be better.
Great. Thank you, Chris. Now we're going to get to another of our priorities under the Community Health Needs Assessment. I do want to be mindful of time. We're at 8 after 1, and we'll look to wrap up at least by 1:30 just to respect people's time. But this is a super important focus, not just for Valley View, but for the community. And I look forward to hearing from a couple of our speakers on these topics. So with that, I'd actually like to introduce someone who joined us midway through the presentation, because I know she was wrapping up with some patient care needs, and that's Michelle Krelovich. She is one of our psychiatric nurse practitioners working closely with Dr. Pete Wiley. We have another nurse practitioner, Brenda Hansen, who joined that practice recently as well. Welcome, Michelle. Thanks for being with us this afternoon. We're going to dive into some of the details that Michelle works on day in and day out, along with some of the other teams here at Valley View for the different elements that you see on this slide. So let's go through some of that. Recruiting for licensed clinical social workers at our integrated primary care practices. Our goal is to have integration with behavioral health right there in the clinics. We have a couple of clinics at Roaring Fork, Pediatric Partners, who offer that currently. We have had that at Internal Medicine and our Eagle Valley Family Practice. We currently are recruiting for social workers at those 2 locations now, but we've seen so much value in that at the primary care warm handoff level to then getting those folks integrated with additional community resources, be it psychiatry or counseling or a host of other opportunities. So I do want to also just discuss for a moment the referrals for mental illness and substance use disorder. Michelle, maybe you could talk to us just for a moment about how we partner with Mindspring as well as the West Springs Hospital and getting folks plugged in for those resources when they need them. Is this a resource that you use often?
Yeah, Rob, we do occasionally use West Springs when the patient is in danger to themselves or others and feel like they need a place to stay. They will take them voluntarily or on a hold to keep them safe and evaluate. And what we see is sometimes these people come into our emergency department or the inpatient areas, and then they do not have a provider to follow up. So then we get referrals back to us for further outpatient treatment.
That makes sense. I know that, MindSprings is the dedicated provider for Health First Colorado members, but we also do very close screening on the inpatient side of things for referrals for mental illness and substance use disorder. In fact, it is one of our HTP measures that we refer patients to the RAY who have those identified diagnoses. So we're very proactive about that work. And that really centers through our crisis team. Not all hospitals have a psychiatric crisis team, and Valley View is fortunate to have that important resource to respond to acute psychiatric emergencies while patients are here in the hospital and help them identify the best resources to address those needs. I'd like to also just ask Chris if you would tell us a little bit about the work that Valley View is doing around postpartum depression screening and referrals. I should say postpartum depression and anxiety is another one of our HTP measures. Chris, can you tell us what we're doing on that front?
Yeah, sure. This one, I'm happy to say that we have been excelling in this measure for quite some time. The Women's Health and Family Birthplace are both very high performers. They screen every mother in the hospital for when someone comes in to deliver. They do a depression screening prior to the delivery and then also post-delivery before the mother goes home. They have resources if there's a positive screen. They have behavioral health embedded to help that mother prior to going home. I can't speak more highly about the work that they're doing right now.
That's great. I know a tricky element of that has been those referrals have to happen within 24 hours of recognizing that need. And so we are working to iron out, ensuring that we are on that timeline for these individual patients who may require additional support. But such an important service around behavioral health for new moms. All right, and one of the pieces that I'm most excited to share is our work on zero suicide. And so, Michelle, you really have done a lot of focus here. One of our other speakers, Amy Johnson, has been integral to the rollout for a new program here at Valley View called the Zero Suicide Initiative. Amy, will you tell us what that's looked like?
Yeah, I'm lucky enough to be a part of this team, which includes Michelle and a lot of our crisis and social workers here at Valley View. We formed this team to help meet our community needs around suicide prevention. And what we've done so far as a committee, we have done some education, not only to our providers, but also to our frontline staff, where they can recognize behaviors that might be troubling and know how to get help for those people. We've had this happen in one of our clinics where a registrar had a feeling like somebody was in some kind of behavioral crisis and actually reached out for help to get help for that patient. So it's important for frontline staff to know this information along with our providers here at Valley View. We're also doing our part of the follow-up project, which is a state grant funded project. And this service actually kind of closes the gap for people that we send home from Valley View. And what they provide is caring contacts for these individuals, where they will reach out within 24 to 48 hours of discharge and continue that those contacts, usually weekly, through a month or even longer if needed by the patient. So it's a great project that we're a part of, and we have referred many patients to the follow-up project. We also are using a Stanley Brown safety planning template resource, which actually we send home with patients when we discharge them. And that goes over a lot of how to reach out for help. What are our warning signs? You know, when we might feel we might be headed towards a crisis. So it's a way, it's something that people can use when they're home to recognize when they might be escalating, who they can reach out to. It also talks about lethal means and a safe environment while they're home. And so we've used this in the past, but we're expanding that, making sure everybody knows it's available, and really making it more robust. Lastly, 988 Suicide and Crisis Lifeline just went national, I think last month, if I remember right, Michelle. And basically they've made this 3-digit phone number. You can text. They have a QR code that you can see on this slide, where it's a national resource for anybody in the community that needs to talk to somebody and needs resources. You can text them, you can call them, and they're available for everybody. They even cover substance use disorders, opioid, issues that are out there in our community. So it's just a great resource for everybody. We have actually gotten a lot of posters, wallet-sized cards that we're currently distributing through our clinics and hospital, so that we can communicate this resource to our community, so they can use it.
Very good, Amy. Thank you.
Yeah,
And I know, such an important focus. Colorado, unfortunately, has a higher than national average for rate of suicide, and it's higher yet on the western slope of Colorado. So it's a topic we take extremely seriously. We want to be proactive. One of the most interesting and I believe novel elements of the Zero Suicide campaign is it's all hands on deck. Everyone at Valley View gets trained about zero suicide, whether that's somebody working in our cafeteria, our front desk registrars, our housekeepers, our physicians. It's all hands on deck for the suicide risk awareness and initial mitigation approach. So thank you, Amy and Michelle, for the hard work you poured into this. Michelle, other thoughts before we move on to additional topics here?
No, well, one thing I was a nurse here at Valley View for 20 years before becoming a psychiatric nurse practitioner over 2 years ago. And I'm just really thankful for those that have participated in community needs assessments that helped us highlight the need for additional services that allowed us to expand the ability to care for our community through our psychiatry department. It's really exciting times to be able to provide that. And it's just so interesting. I have to share this little tidbit. I know we're running short on time, so I won't keep it long, but I was visiting family in Ohio this weekend, and my sister wanted to roam through some old boxes in the attic looking for Garbage Pail Kids cards, and she was delighted to find them, some real treasures. And I actually came across a paper that I wrote as a junior in high school. And my thesis was that we can become more aware of a person's vulnerability to suicide by studying physical and emotional signs. Anyway, I thought that was an extraordinary coincidence to come across that paper and think about the work that I'm currently involved with Envision Suicide, Envision Zero Suicide, and how exciting it is that there is a national platform that we're engaged in now to provide education to our fellow providers and colleagues and our entire workforce to just further identify those at risk and be able to connect with resources and the new suicide, the new crisis line 998 it seems like things are just lining up and
that's pretty special that it's come full circle like that, Michelle. Thanks for sharing.
Yeah.
Pretty cool story.
So reach out if anybody has questions, clarifying information anytime.
Perfect. Thank you. Lastly, I want to pivot to some of the good work we're doing around our emergency department. And we do have Jen McPherson on, as we introduced Jen earlier. So the first element here is alternatives to opioids. Another huge topic that we know has big implications for every community hours included. Jen, will you just frame what the ALTO initiative is and what that looks like in our emergency department?
Sure, I'd be happy to. Thanks, Rob. So ALTO stands for Alternatives to Opioids. We are kind of partnering with Colorado Hospital Association along with 44 other hospitals to really introduce protocols or parameters for healthcare providers in the emergency setting to help reduce the opioid epidemic, essentially. Yearly, over the past 5 years, really, there's been an increase in overdose from opioids nationwide, and Colorado has kind of followed along with that parameter. So what the ALTO initiative does is gives tools to healthcare providers to provide other means for controlling pain in an urgent care situation that doesn't lead to an opioid addiction, basically.
Yeah, perfect. Well stated. And while I have this slide up and I look at Dr. Brooks on screen and realizing he is very attuned to seeing data, and the data that you see in front of you on the screen, really frames that we still have our work cut out for us, because we are not exceeding the state average with this measure, and we desire to be better. And so we will be working hard on this. This presentation isn't just about sharing the good work that Valley View is doing. We know we do have opportunities, and this is one of them that we're going to be getting at. The good news is Hospital Transformation Program fosters a process for that, and that it's a 5-year program. We work incrementally. There's so many strings attached to making sure we do it right. And so we want to do it right. This is our baseline data. So another slide will, demonstrate some of that same data trend. You see kind of paradoxically, when we have a higher opioid use rate, and this is administered in the ER, not prescriptions going home, but administered in the ER, when our administrations of opioids go up, it tends to be that alternatives to opioids goes down and vice versa. So awareness of this and continuing to foster appropriate practice of alternatives to opioids being administered through emergency department, important not just with our providers or physicians in the ER, but also the staff, and even educating patients on how effective these alternatives can be. Any additional thoughts there, Jen, before we move on in the last several minutes here?
No, I'm just glad that you said that. It does take a team to tackle a project of this magnitude, and the emergency department team definitely is taking this on and taking it seriously and trying to contribute positively to this epidemic.
One other element before I move on to the final topic is that we are offering opioid reversal medication through our emergency room and through the inpatient care areas. If somebody is recognized as needing pain medication or using pain medication, or even has opioid use disorder, and we are trying to help that patient with that disorder, an opioid reversal agent can save lives. And our pharmacy department is working closely with those other hospital areas to get patients those medications for free to walk out the door with. And we know anywhere from 10 to 30% of those naloxone samples that are given for patients leaving can be utilized to save someone's life. It is not rare that those get used, and we're happy to be really in a novel place statewide participating in that naloxone distribution project. So kudos to our pharmacy folks for having that momentum and inertia. Finally, we're going to pivot to Jen yet again here, as well as Stacy. They've done a ton of work around our up and coming local detox facility. Stacy, do you want to frame that, and then maybe Jen weigh in on some of the work you've seen boots on the ground there in the emergency room?
Yeah, sure. So I apologize. This is a pretty text heavy slide, but we appreciate that we have community members who need support and care for substance withdrawal. And it can be a number of substances, alcohol, methamphetamines, opioids. And as we began this conversation, Dr. Brooks affirmed that here at Valley View, it's about putting our patients first. And so while we have an extraordinary team in our emergency department that is capable and on a regular daily basis cares for community members who need assistance with substance withdrawal, we also feel like we can do better as a community in terms of trying to support not only that substance withdrawal, but really creating more of a wraparound approach and really looking at recovery. And so this has been a 3-year journey within the community. Valley View, the city of Glenwood Springs, Grand River Health and Rifle, the municipalities along the Roaring Fork and Colorado River valleys, really coming together to talk about how can we as a community establish and sustain local detox services for the benefit of our community members. And one of the challenges with withdrawal management is financial. And so in the past in our community, we've had some detox centers and services, but the community has not been able to sustain those. Those operating entities have not been able to sustain those services. And so the model we're moving towards right now and hopefully will become a reality for our community in 2023 is that an incredible collaboration that includes Valley View and all of those entities that I referenced are, going to partner with Mind Springs Health, which has graciously offered up its space in Glenwood Springs to have a social setting withdrawal management program. And so, Rob, if you want to kind of toggle through the next couple of slides, this is some data that we've used to inform this work, not only to support Mind Springs and creating that program, but to really just illustrate how as a community we can come together to solve what is a community challenge. So this is data, these 2 slides representing both Valley View and Grand River Health. You can see some of the substances that have been used. You can go through the next one, Rob. And this is for us, how people have been coming into Valley View Hospital for that kind of care. So I think, it feels like it's like right around the corner that we as a community will be having this, what we call swim. So I guess my ask for those of you on the town hall, if you know people with the city of Glenwood, Grand River Health, town of Carbondale, please just encourage them as they are thoughtfully considering their partnership, that this is really an extraordinary opportunity for our community to come together. So I will pitch it back over to Jen because I think she can further illustrate kind of the need and the opportunity for this kind of community swim.
Thank you, Stacy. I think you did a great job covering this topic coming from the emergency department perspective. It's always a little bit disheartening when you're caring for patients and don't feel like you have the resources necessary to really give the patients what they need for follow-up care or for continuation of care. Like I had stated before, I worked for Valley View for 25 years, and I've seen some of these other detox centers come and go. And it's been extremely disheartening to lose resources in our community that are essential to really support everyone's care. So seeing this detox center come to life again is extremely exciting for all of us in the emergency department to really ensure that we're providing the care necessary for these patients, the appropriate care. And sometimes when the ER gets extremely busy and we're trying to care for all of the things that are happening, those our resources here get stretched thin, and this is just going to really help reinforce that care for our community. So I think it's great.
Thank you, Jen. Well, that really wraps up the elements that we wanted to touch on as a group, but we are at 1:30 at time. I know myself and Stacy can stay on to foster further discussion, answer questions, and accept the feedback that anyone may offer for us. I realize some of our other speakers may have other commitments that they need to attend to, including patient care. So if you have to jump off, certainly we understand. But I'd like to just open up the floor for those of us remaining. If there's any questions and feedback that we didn't touch on, or just things you'd like to go into more detail on. I don't see any hands up, Stacy. Have you seen any
I
other
don't either.
comments in the chat?
No, I don't.
Okay. I know Stacy.
I mean, I would
was-
just say as I know we covered a lot, to all of you who've joined us, thank you. But as you continue to reflect, we want to make ourselves available. So please don't hesitate, just call the main Valley View line, ask for myself or Rob, because as much as we have a lot of work here at Valley View, any opportunity to link arms with your organizations, the business community, other community conversations, that's what we want to be a part of, because that's how we're really going to move the needle in addressing these community needs. So yeah, just call, we're here.
Yes, thanks for everyone who joined us today. Unless there's anything further, take advantage of those resources that Stacy had been dropping into the chat with those links. And again, as Stacy mentioned, we remain open to feedback, collaboration. That's why we're here. We really do believe in it. And so reach out to us at any time.
Thanks, everybody.
Thank you.
Thanks. Have a wonderful afternoon. I appreciate you joining us.
Thank you.
Bye.